When it comes to holiday giving, I like to follow a one for you, one for me approach, especially when I'm shopping at Quince. From Mongolian cashmere sweaters to Italian wool coats, everything at Quince is such beautiful quality at prices that actually make sense that yes, I can do one for you and one for me. One of my favorite finds this year is the stretch crepe trench coat. I got it in black. It's so sleek, it's so flattering. It just really pulls an outfit together, even if I'm just throwing it on over jeans or leggings to run to the grocery store. The craftsmanship really shows through in every detail, the stitching, the drape. It's so timeless, and I'm definitely wearing this one on repeat. Quince has something for everyone. Soft Mongolian cashmere sweaters for $50 that look and feel like designer pieces, silk tops and skirts for dressing up, perfectly cut denim for everyday wear, and outerwear that keeps you stylishly cozy and warm. Plus, Quince has gifting covered for the home too. So if you've got someone on your list who's maybe a little hard to shop for, they've got things for the bath, the kitchen, and even for travel. Find gifts so good you'll want to keep them with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Let's be honest, your shift doesn't start when you badge in. It actually starts before that. I would say even from the moment you get dressed. And if you're anything like me, what you wear can make or break the vibe of your whole day. And that's why I love Figs. Figs make scrubs for modern medicine. When I was in nursing school, the scrubs they handed us were, well, not so great. Boxy, scratchy, stiff, like someone sewed together a paper bag and said, "Yep, that'll do." Figs came along and said, "No thanks." Their scrubs are comfortable, flattering, and thoughtfully designed for real healthcare humans. They're antimicrobial for protection, they're tough enough to survive wash after wash, and stylish enough to meet a friend out for coffee before your shift and still look great. With the holidays right around the corner, it's a perfect time to treat yourself to some fresh looks for the new year, which is great because Figs just dropped a ton of new limited edition colors and styles for the season. From scrubs to accessories to footwear, Figs has something for every awesome human. If you want to check them out, Figs is offering 15% off your first purchase at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX. Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In this shorty episode, we're talking about low-sorb tubing, what it is, why it matters, and which medications you'll likely be using with this type of tubing. So what does this actually mean for something to be low-sorb tubing? So some IV medications can actually bind to or be absorbed by the material in standard IV tubing. So if that happens, part of the drug gets basically stuck in the tubing instead of actually reaching the patient. So low-sorb or low-absorbing tubing is made of special materials that minimize this effect, ensuring the patient gets their full prescribed dose. So standard IV tubing is often made of PVC, which is more likely to absorb certain medications. And then low-sorb tubing uses materials like polyethylene or polypropylene, which reduce drug loss. They are low-absorbing materials. So when do we use low-sorb tubing? So the most common medication you'll see given through low-sorb tubing is nitroglycerin. If nitroglycerin is infused through PVC tubing, a significant portion of the drug can bind to the tubing instead of actually reaching the patient. This means your patient may not be getting the dose they need to take care of their blood pressure or whatever reason that they're getting that nitroglycerin infusion for. What about insulin? Insulin is another medication that binds to PVC tubing, but many facilities don't use low-sorb tubing for insulin when we're giving an insulin infusion, and that is because we prime the tubing with insulin, meaning we saturate all those binding sites. We run, I want to say it's like 10 mils of insulin through it. I forget the exact amount. I haven't hung an insulin drip in a long time since I left the ICU, but just know that that tubing will be primed with a fair amount of insulin to saturate those binding sites. And once that tubing is basically coated on the inside with insulin, the rest of the medication flows through at that expected dose. So if you're new to hanging insulin drips, or you're with someone who's hanging an insulin drip and you don't see them initially priming that tubing, you might want to speak up, because skipping this step could mean the patient isn't actually getting their full dose of insulin therapy. And then later, when their binding sites in this tubing are saturated, now they're going to be getting more, which is going to make your insulin delivery very much inconsistent, which can actually be pretty dangerous. So making sure that you prime that tubing if you're not using low-sorb tubing with insulin. Another one is chemotherapy drugs. Chemotherapy medications are considered hazardous and do require special handling, and many are given through non-PVC or low-sorb tubing to prevent drug loss and protect the patient. You're always going to follow your facility's oncology protocols because chemo is highly specialized. Unless you are a chemo certified RN, you're not hanging any chemotherapy medications. Now, a special note on pediatrics. Pediatric patients are really sensitive to drug loss in tubing because they receive smaller doses overall. So even a small amount of medication absorbed into the tubing can mean a significant underdose for a child. So for this reason, low-sorb or non-PVC tubing may be used more frequently, more commonly in pediatrics, depending on the medication. So some key takeaways. Always check your facility policy or IV medication reference to see if low-sorb tubing is needed, and label the tubing. When you're using low-sorb tubing, label it. And then I would say know which tubing in your facility is low-sorb tubing, how to request it from central supply so that you're confident that you are using the correct tubing. And that is it for today's quick tip. I will see you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Doug. Here we have the Lemur Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.